Class, let's talk about physical and chemical control of our microbes. So when we control our microorganisms, one thing that we really need to take into consideration is the degree of exposure in our lives. This is a monumental concern for most individuals. So how we control the degree of exposure that we have is going to be something of vast importance. Many of you are planning on going into healthcare. This chapter is going to have a lot of application for you, hopefully a little bit more than the biotechnology chapter. So how can we go through microbial control? There are 4 probable methods or outcomes that we will talk about. Those are sterilization, disinfection, decontamination, aka sanitation, and antisepsis. Now, I'm going to be really pedantic in this class, so I'm going to be really nitpicky. Sterilization is not the same as disinfecting, or the same as antisepsis, or the same as decontamination. So let's elaborate on the differences between those 4 things. When we sterilize something, we remove all viable microorganisms, all vegetative cells, all bacterial endospores, all viruses. So during the sterilization process, we are going to have kind of the gold standard. So sterilization is the ideal. Sterilization is not possible in most situations. For example, let's say that you're working with a patient and you are swabbing some iodine on them before making an incision or an injection. You absolutely are not going to be able to sterilize them. You're not going to be able to remove all viable microorganisms from the surface of their skin. If you did that, you would kill the patient, because the process of removing those microorganisms would also destroy the patient's tissues at the same time. So that we have to have some give and take. One step below sterilization is disinfecting. During disinfecting, we remove all the vegetative pathogens, but we don't necessarily destroy those bacterial endospores. So if we look at disinfecting, examples of disinfecting include bleach, iodine, or just boiling at room temperature. That's going to be much more attainable. We can rub bleach on something. We can rub iodine on something. So when you're making an incision on a patient, you typically will disinfect the patient beforehand. You'll swab that iodine on them and remove the vegetative cells from the surface of their skin. Sterilization is much trickier. We need to use heat. Typically that heat's going to be in the form of an autoclave. You can think of it as a glorified pressure cooker. And if any of you have done your own canning at home, you can understand that putting something through a pressure cooker is a pretty aggressive process in terms of sterilization. Next up, after disinfecting, we have sanitizing or decontamination. During decontamination or sanitizing, we are going to have mechanical removal of large pieces of organic debris and microorganisms as well. Decontamination isn't necessarily going to remove vegetative cells. To remove the vegetative cells, you have disinfecting. During decontamination, there still are plenty of vegetative cells on the instrument or the physical object that's being decontaminated. But we lower the concentration of vegetative microorganisms to a safe level. Good examples of things that are decontaminated include plates, cups, forks, spoons, or if you work with utensils, or if you have something that needs to be some kind of hard physical object that's going to be reused very quickly. So things that are in typically the restaurant industry or that are associated with food. To decontaminate something, typically we have soap and a dishwasher or detergent. So a little bit of elbow grease, a little bit of soap, hot water, and a rinse will decontaminate something. Decontamination is perfectly acceptable in the vast majority of situations. And then finally we have antisepsis or germination. This is going to be the lowest standard of cleaning. This is going to reduce the number of microbes on human skin. This is different from disinfecting. During disinfecting, we have a very aggressive chemical treatment that will remove vegetative cells. During antisepsis, we have a much more gentle chemical treatment to reduce the number of microbes. During this antisepsis process or degermination process, we are still going to have microbes present on the human skin. Antisepsis is typically used when you are dealing with live tissues and you don't want to take the time to thoroughly remove all vegetative cells. Antisepsis is typically going to be acceptable in the vast majority of situations where you aren't super concerned, because there probably is not going to be a lot of direct contact between the object that you're degerminating and the object that you want to keep sterile or you're worried about having contamination issues with. Good examples of things that go through that will give you antisepsis include washing your hands with a surgical hand scrub or an alcohol sanitary wipe. Here's a great flow chart from your textbook that breaks down physical, chemical, and mechanical methods for microbial control. Our physical methods are going to be kind of heavy on the sterilization end of the spectrum. So when we think of sterilization, I want you to think of completely removing all vegetative cells and all bacterial endospores. So we have incineration, burn that object. That's going to be a dry heat, or you can put it in a dry oven and just bake the living daylights out of that object. You can use moist heat, so think of an autoclave or pressure cooking something, or you can use a boiling water bath. Boiling water baths are typically done at room pressures, so regular atmospheric pressures, and these boiling water baths are going to remove vegetative pathogens, but don't necessarily destroy the endospores. We can also use radiation. If we use an ionizing radiation, such as gamma rays, X-rays, we can sterilize the object so we can kill those endospores. But if we're not worried about the endospores, we can just use a non-ionizing radiation like ultraviolet light, which is what is commonly used in most situations. For chemical agents, we can have gases depending on the gas for sterilization or disinfecting, or we can use a liquid to remove the microbes. If it's an inanimate object that we aren't worried about killing, we can have antisepsis take place. If it's an animate object that we're worried about killing, we'll have antisepsis take place. So that's those alcohol wipes, the surgical hand scrubs. If it's an inanimate object that we aren't very worried about killing, we can go through more aggressive liquid treatments. We can also use mechanical methods to remove microorganisms. If we filter the liquid, we can sterilize the liquid because we can use quite small pores. A milli-Q filtration system typically can filter out anything that is 10 nanometers or larger. So it can get very small pathogens removed from the liquid. And if we filter the air, think of something like a laminar flow hood, we can decontaminate. We can remove the vast majority of most microbes from the air if we run it through a very expensive laminar flow hood. So let's talk about these different microbial forms and how hard they are to kill. The goal of sterilization is to kill the endospore. The endospore, and that's on the bottom of the screen here, is the primary goal for killing during sterilization because the endospore is the gold standard, so to speak. It's the hardest to kill. So if we can expose our object to a process that can kill the most resilient form of a microbe, then all the other microbes are going to be caught up in the crossfire and die in the process, or be deactivated. When we are choosing a target for microbial control, typically we're doing it because we want to reduce human infection rates or human spoilage rates. Our target populations that we are going to disinfect will almost always, in every situation, have a mixture of microbes, and these mixtures of microbes will be different species, different ages, and there'll be a combination of vegetative cells and bacterial endospores. So we need to choose a technique that can kill the most viable cells possible. Sterilization is the gold standard. It's a technique that kills both the endospores and everything else. So when we talk about sterilization, we're at the level of killing bacterial endospores. And if we can kill those bacterial endospores, then everything else underneath, our mycobacterium, our protozoa, our fungi, non-enveloped and enveloped viruses, our gram-positive bacteria, will be killed off. They will be destroyed. Notice at the top we have prions. We don't necessarily have a good method for removing prions. Prions, unfortunately, are resistant to wet heat. They can make it through an autoclave. The only tried and true method I know that can destroy prions is incineration. The problem with incineration is you also destroy the object in many situations that you're trying to save, unless it's very heat resistant. So let's look at this table from your text that just compares how tough it is to kill different things, and depending on the method that you use. If we're using a moist heat, so think of like an autoclave, a bacterial endospore can be killed at 120 degrees Celsius. A vegetative cell can be killed at 80 degrees Celsius. So the bacterial endospore is always going to be more resistant, If we use radiation, it takes 4,000 grays of radiation compared to 1,000 to kill an endospore versus a vegetative cell. If we use ethylene oxide, it requires a much higher concentration of ethylene oxide to kill the endospore compared to the vegetative cell. And then finally, if we use a 2% glutaraldehyde, they'll take a 3-hour exposure to that solution to kill the endospore as opposed to a 10-minute exposure to kill the vegetative cell. So in every one of the situations we look at, it's more difficult to kill the endospore than it is to kill the vegetative cell. So let's talk about agents versus processes. When I talk about an agent, I'm talking about a chemical compound that kills a specific kind of microorganism. When I'm talking about a process, I'm talking about sterilization, disinfecting, antisepsis, degermination, so on and so forth. So if we look at sterilization and disinfection, those are two of the processes we've talked about. Our other two processes are on this screen right here. So all four of them are listed here. We have sterilization, disinfection, sanitation, and antisepsis. Those are our four processes, and then we have agents that help us with these processes. A bactericide, as its name implies, is something that kills bacteria. Cide means death. Bactericide is a chemical that kills bacteria, except for those that are at the endospore stage. A fungicide kills fungal spores. Virucides deactivate viruses. Sporicides are capable of destroying bacterial endospores. And then germicides, or microbicides, are generic agents that just kill microorganisms generically. So think of alcohols or bleaches in those situations. Sepsis is known as the growth of microorganisms in the blood or other tissues. In a healthcare setting, sepsis is almost always going to be referred to as growth of the microorganism in the blood. Blood sepsis is a very common condition and a big issue in healthcare. We also have asepsis. As its name implies, it's going to be the opposite of sepsis. It's anything that prevents the infection agent to move into the sterile tissue. So it prevents sepsis from occurring. Aseptic techniques are techniques or procedures that help prevent the growth of microorganisms in the blood and other tissues. These techniques help to prevent sepsis. You practice aseptic technique all the time in healthcare. When you wash your hands before seeing a patient, when you're done seeing the patient, by wearing gloves, by gowning up in your scrubs, so on and so forth. These are the procedures that you go through to minimize your exposure to the potential pathogens and microorganisms. An antiseptic chemical is a chemical that we can apply directly to the skin or mucous membranes. These antiseptic chemicals, generally speaking, are going to be relatively mild. And I say relatively mild because I'm comparing them to the chemicals that are used for decontamination and sanitation. Antiseptic chemicals are ideally going to destroy the microbe but not destroy the host tissue. So when you disinfect a patient, you don't want to kill the patient in the process of disinfecting the patient, so to speak, when you go through this antiseptic process. So we can go through antiseptics when we prepare the skin for a surgical incision by swabbing with iodine, or swabbing a root canal with hydrogen peroxide, or just using a germicidal soap. When we look at the word static or stasis, in Latin it literally means to stand still. So if we look at a bacterial static is going to be a chemical that prevents the growth. It causes the population count to stand still and to cease growing. A fungostatic does the same thing for fungals. It inhibits fungal growth. Antiseptics and drugs are almost always have a microbial static effect because microbial compounds can be toxic to human cells. If we look at these antiseptic compounds, these microstatic effects are going to be degradative. They're bad, not necessarily the greatest thing for human cells. Low exposure to hydrogen peroxide, for example, to disinfect a wound is a good thing. But constant exposure to hydrogen peroxide is actually going to cause the wound to degrade. This is one of the reasons why hydrogen peroxide is starting to fall out of favor as a way to go through antisepsis, or a way to remove microbes from living tissue, because it's been found that hydrogen peroxide also destroys quite a bit of the tissue. Now, you're always going to have to be in a situation where you use your best judgment depending on that specific healthcare needs of the patient or the individual. Maybe it's better for the patient if they lose some tissue in the process of losing those microorganisms. whenever we're working with a cidal agent, so an agent that kills, it doesn't necessarily result in sterilization, because it's always very important how we use it. The length of exposure, the concentration of exposure, and the temperature of exposure are all very important things. So let's look at some practical matters that we need to come to terms with. One is the critical medical devices. These critical medical devices are going to come in contact with sterile tissue. And because they come in contact with sterile tissue, they need to be sterilized before they are used. These are things like scalpel blades, for example. They must be completely cleaned before being used. We also have semi-critical devices. These semi-critical devices come in contact with non-sterile tissues, but like a mucous membrane, but we don't necessarily want to introduce new pathogens to the patient's tissues, so these semi-critical devices are still going to receive a very high level of disinfection. So I use a scalpel as an example of a critical medical device. A semi-critical device could be a nasal cannula for delivery of oxygen to a patient. It's important that it's clean, but it's not as important as the scalpel blade. And then we have non-critical devices. Non-critical devices are not going to come in direct contact with the patient. Or if they do, they're only going to touch intact skin on the patient. These non-critical devices include nitrile gloves. Yeah, nobody uses latex gloves anymore. So nitrile gloves or clothing or bed sheets, for example. And these non-critical devices require only a very low level of disinfection. Now, some substances that we work with that are going to require sterilization, so the removal of all vegetative cells and the removal of all bacterial endospores, include durable solids and sensitive liquids, and everything in between. Durable solids, generally speaking, are much easier to sterilize than sensitive liquids. The situations that require sterilization confront people in healthcare all the time. And when you're trying to determine how you're going to sterilize something, the three things you need to consider are: what's the cost, how effective of it, and what is the method of disposal? How much of a headache is it to clean up the mess after the fact? I know for me personally, since I work a lot in a laboratory setting, since I work in education now, my go-to methods for sterilization include the autoclave. I throw stuff in my glorified pressure cooker and bake the living daylights out of it to sterilize it before I throw it away. It's quick, it's easy, but I already have the autoclave, and it works for what I have. I'm not trying to keep a patient's tissues alive. I'm interested in killing absolutely everything. So we'll talk a little bit more about some of these methods that we'll use in a couple of slides when we talk about bleach versus alcohol, so on and so forth. What is microbial death? The death of a microbe is very different from the death of a macroorganism. If you look at a human being, when the human dies, the multicellular organism dies, generally speaking, there's going to be a cease of those vital life functions, but there still are living cells within that macroorganism, even at the time of macroorganism's death. For example, when a human being dies and their brainwave functions stop, or their heart stops beating, most of the cells of their body are still alive at the moment of death. For a microbe, though, when they're only a single cellular organism or a unicellular organism, it's a little bit tougher to tell. It's not quite as obvious. It's not like we can hook up a pulse oximeter to a microbe to measure its blood oxygen concentration or to see if its heart is beating. So it's a little bit more difficult to tell when the microbe dies. Death for a microbe is defined as the permanent loss of the ability to reproduce. So if that microbe cannot reproduce, even when it's given optimum growth conditions, it is, by definition for microbial death, considered dead. So death for a microbe is the inability to reproduce. Now, if we're trying to kill a microbe in culture, we have billions and or trillions or hundreds or trillions of cells. And the whole population doesn't die all at the same time. We'll have first a few die, a couple cells here and there die, and then that rate of death typically is going to increase exponentially or logarithmically. So first we need to meet the certain threshold concentration to induce death. Once we meet that minimum threshold concentration, we'll have that trickle effect where a few microbes die, then the rate of death accelerates. When we're looking at the rate of death, the first cells that die are typically the cells that take up the most of the disinfecting agent or the cytal agent. And those are typically going to be the vegetative, the actively reproducing cells. They're going to be actively bringing in raw building blocks from their extracellular environment so they can continue to grow. And these active vegetative cells will bring in more of the chemical that's going to kill them, and they, generally speaking, die quicker because they have a higher metabolism. Eventually, though, a point is reached when the survival of any cells is very unlikely, even the non-metabolically active cells. At this point, we consider whatever it is we're working with sterilized. So, what can influence the death rate? The number of microbes absolutely can influence the death rate. The higher the concentration of microbes, or the higher the number of microbes, the longer it takes to kill them all. Remember, they don't all die at the same time. It's a Gaussian curve, so to speak. And then also the nature of the microbial population. Is it going to be in a biofilm? If it is, god darn it, it's going to be really hard to kill. Is it a pure culture of fresh young cells? Is it an older culture of mixed populations of bacteria, fungi, and viron particles, that some of which may be in an endospore stage? And then finally, the temperature and the pH of the environment are also key factors. Generally speaking, the higher the temperature, the quicker they'll die, because there'll be more Brownian motion, and there'll be the disinfecting chemicals will be able to have a faster rate of diffusion and be absorbed into the cell quicker compared to those lower temperatures. And then finally, the pH of the environment also influences the rate of absorption, because the pH environment can influence the total charge of the disinfecting molecules. If we have a positively charged disinfecting molecule compared to a negatively charged disinfecting molecule, that can be altered by the pH of the environment, and that will alter how attracted it is to certain microbes. We also are interested in the concentration, or the dose of the disinfecting agent. High concentrations, high doses are more powerful than low concentrations, low doses. The UV radiation wavelength that's most effective is 260 nanometers. And if we deviate from that 260 nanometer wavelength, the light is not as disinfecting. It is not as effective at killing the microorganisms. If we look at disinfectants or chemical compounds, those cytal agents, generally speaking, the higher the concentration, the more active its disinfecting abilities are. And then finally, how does that agent kill the microorganism? What does it do? Does it directly kill, or does it inhibit the growth of that microorganisms? And then finally, we can have other random chemicals in solution. Is there going to be a solvent, or some kind of interfering organic matter, or some kind of inhibitor present? For example, if we're working with feces, there's lots of excess organic matter that inhibits the disinfecting process. There's those unprocessed solids from your digestive tract that allow for bacteria to have many hiding places. Saliva is another example. Saliva contains a lot of liquid that may potentially, it's both saliva and blood, that may potentially reduce the ability for you to disinfect a chemical compound, because when you add your disinfecting agent to these liquid compounds, that disinfecting agent becomes diluted and you change the concentration of it. When we look at our antimicrobial agents that we use for disinfecting, they have a very wide range of cellular targets. Sometimes they'll be very selective, sometimes they're not very selective. The less picky the agent is, the more effective that agent is at killing the microorganisms. The least selective agents are burning and blasting with radiation. So if you burn something, it doesn't matter what you're exposing to, it's exposing to the open flame. The open flame is going to burn that object and burn that part of the cell. Or we could have a selective agent. For example, we can have a specific kind of antimicrobial drug or antibiotic drug. Those antibiotic drugs are designed to target specific cellular machinery within the microbes and are very nitpicky and selective. And they work great for some situations, but work very poorly for most situations. Common targets for both physical and chemical agents of disinfecting include the cell wall, the cell membrane, cellular synthetic processes, so some part of the some metabolic pathway within the microorganism, like protein synthesis or the production of a necessary amino acid, for example, or we could inhibit the proteins within the microorganism directly. If we look at things that target the cell wall, chemical detergents, so soaps, alcohols, and a wide variety of chemicals can target the cell wall. The cell wall is a common target because it's on the surface of the cell. It's easy to get to. If we look at the cytoplasmic membrane or cell membrane, soap or detergents work really well at targeting the cytoplasmic membrane. All soap is mildly disinfecting, even if it doesn't have antibiotics in it, because all soaps will break apart the cell membrane of the microbe. If we look at chemicals that can target metabolic pathways within the microorganism, those include formaldehyde, radiation, and ethylene oxide. And then finally, if we want to target the proteins themselves within the microorganism, we can cook it with moist heat in an autoclave, we can expose it to alcohol, or we can expose it to phenols. A phenol is an acidic alcohol. So if we look here, alcohol targets both the cell wall and the proteins within the cell. Detergents target the cell wall and the cytoplasmic membrane. So washing your hands with soap and then a follow-up with an alcohol hand sanitizer is a great way to remove many of the active microbes from the surface of your skin. Here we can see some surfactant or detergent molecules. These detergent molecules are starting to bind with a cell membrane. And as more and more of them bind with the cell membrane, they disrupt the integrity of the cell membrane, such to the point that the cell membrane begins to fall apart. It begins to become dissolved in solution, because that's what soaps do or detergents do. They help you dissolve fat into solution, or lipids into solution, and as these phospholipids from the cell membrane become dissolved in solution, the cell membrane breaks down and then the cell is destroyed. So, concept check, class. If we use iodine compounds to prepare the skin for surgery, what is it known as? Is it disinfectant, antisepsis, sterilization, sanitation, or degermination? If you don't know, that is okay. You can pause the video, rewind the video, you can flip back in your PowerPoint notes, or check your textbook. Alright, let's find the correct answer. We'll flip back here to the beginning of our PowerPoint. And we have sterilization at the top. That kills everything. And at the bottom, what we do to open skin, we have antisepsis or degermination. So, our correct answer is E, degermination, or B, antisepsis. So there are two correct answers, depending on which term that you feel more comfortable using. So this is a poor multiple choice question. I'll need to rewrite that. Hint, hint. You guys have a great day. If you have any questions, please feel free to email me or post them on the discussion board. Happy studies!